back here at the Fraum Center. We are thrilled to be here. Henry, Criss, great to see you again. Dr. H, great to see you again. You know, the last time we talked, it was really interesting. You gave us a broad overview of the rebranding of the Fraum Center, and it's really exciting. I would like to learn a little bit more, Henry, about how you all played together and your role in this.
Yeah, certainly, Debbie. You know, it's really a complementary role, right?
Mm-hmm.
So with her background and how excellent she is at taking care of patients and you know, diagnosing and treating and all those clinical skills, you know, to operate effectively, we need somebody to sort of mind the store, so to speak.
Actually, that's a great way of saying it.
Yeah.
Yes. Uh-huh.
And so my role is really just overseeing the business operations, right? Everything that's not clinical.
So she's patient-centric.
That's correct.
That's your goal.
Yes.
And you said it before, sort of the back behind the scene.
Yeah, right. And really, you know, one of the things that differentiates us from a lot of different practices and other really just businesses is everything we do is patient-centric.
Exactly.
And so, you know, it's my job to keep the staff trained and focused and doing what it is that they do, so that our providers like Dr. H and our other providers can really do what they do, which is take care of our patients.
Don't you love it when we're talking about you?
Oh no, it's totally fine. I mean, the reality is, you know, we've got to keep the lights on.
Yes.
And if I have to worry about keeping the lights on, I'm not paying nearly enough attention.
You can't focus on your folks.
I like to tell people, you know, if it were up to her, we just give it all away.
Right. Oh, I love her. Exactly. I know exactly. That's a medical thing because you really care. And that's that's exactly right.
Exactly.
What was really interesting is we were talking before about who comes. And you were saying initially that right now they're reactive. People who usually having bad knee or some kind of inflammation or something going on. And the idea for you is kind of flip that on its head. Talk to us a little bit about that.
Absolutely. You know, right now, we as patients are going to see our physicians when we're sick.
Yeah. Yes.
We are. And here's a crazy notion. Maybe we go see our physicians to stay well. I will tell you, you walk into your average medical office these days saying that, and they're going to look at you like you have 3 heads.
But it makes so much sense.
It does. It really, really does. And so we are really trying to leverage this knowledge from all these different disciplines to keep patients healthy.
Dr. H, talk to us a little bit about some of the protocols that you're using within this practice now.
Absolutely. We have patients come to us with a number of different complaints. We have a number of options for those. Obviously, this with the chiropractic history of the clinic and the chiropractors we have on staff, we get a great deal of spines.
Oh, okay.
Okay.
Makes sense.
Again, Western medicine does not have a great answer for spine disease.
Okay.
So that is where I think we really shine especially. We have some machines that help with the symptoms.
All right.
But also we have some stem cell options if it's appropriate for the patient.
Can you talk to me a bit about obesity? Because I know that that's a huge issue in the Western culture right now.
Yes, it is. And you know, what's really amazing about where we are with obesity care these days is that it's not just talking about, oh my gosh, this is so bad for us, but we are seeing a group of medications that are completely changing the face of obesity care.
100%.
It is so amazing. So we are helping people. You know, I'll give you an example. I had a patient yesterday. Knees are terrible.
Okay.
He is very interested in stem cells, possibly for those knees. Went to go see an orthopedic surgeon to talk about stem cells. This patient is extremely obese.
Okay.
The orthopedic surgeon said,
lose weight.
See you later. Give me a call when you do. Now, this is a patient who has been struggling with this for years. That's not a realistic outcome. So for him to be able to walk into this clinic and hear me say to him, yeah, you've got to lose weight. I can help you do that, but I can help your knees too.
So basically you are providing that 360 comprehensive treatment all the way around.
Yes. Yes.
Wow, what a gift for your patients.
Yeah, it usually takes a big cognitive load off. They don't have to worry about who do I need to see for this and who do I need to see for that? Because, you know, if I can't take care of it, I'll tell them. But we really strive to keep everything under in-house so that we can know everything that's going on with the patient.
One of the things that's fun for me is the more we talk, the more questions I have. So I think that's really interesting. So again, don't be afraid to come in and inquire because this really is a comprehensive treatment facility. It really is.
Well, people ask, can you? And the answer is absolutely.
Exactly.
Right? Because what we're focused on is not so much what's wrong with the patient or what we're focused on is the outcome. What do we want to accomplish? What does the patient want to accomplish? And then what do we leverage to get them there?
That makes so much sense. Thank you for joining us. Stay with us, more to come.